We shall go on to our next speaker, Dr. Sandra, who's a medical consultant. Thank you. Medical consultant, pediatric ophthalmology and adult establishment services from Arvind Eye Hospital, Coimbatore, another very dynamic surgeon. And let's hear what she's going to be talking on what's new in amblyopia management. On to you, Dr. Sandra.
Yes, thank you. Yeah, I'm going to talk about the recent advances in amblyopia management. So amblyopia is one condition where the applications of artificial intelligence is going to be really high in the next couple of years. So I do not have any financial interest in any of the products shown in this presentation. So coming to the question of why treating amblyopia is very important, because the deficit in amblyopia extends beyond the monocular visual acuity impairment into a lot of higher order functioning, which includes binocular vision, fixation, instability, and abnormal binocular interactions. And for certain fields, like especially with fields like aviation and surgery, the 3D depth perception is extremely important. So what are the problems with the traditional therapy? Traditional therapy does remain the gold standard, but the problems include poor adherence, especially with regard to compliance. As the age increases, it becomes increasingly difficult for the parents to make the child comply with the patching schedule every evening, especially when it comes to severe amblyopia. There is a lot of psychosocial impact and stigma. So atropine is the other alternative, but it causes light sensitivity and reverse amblyopia, and there is a lot of systemic side effects. And with traditional therapies, there is difficulty in achieving true equalization. It does not address suppression, and definitely we get only some improvement in the visual acuity and no 3D effects. So all the newer therapies with regard to amblyopia are dependent on neuroplasticity. So the basic idea about neuroplasticity came when people used to get injured in the good eye and lost the vision, and later on it was found that even in the adult age group, the amblyopic eye used to improve and the vision used to increase. So the plasticity of a brain does not end after a certain age, and a lot of lateral connections are possible. So the newer concepts with regard to amblyopia is that it is more of a binocular rather than a monocular disease. Hence, it is necessary to find stimuli and ways to stimulate the specific plasticity of the adult brain. And the most common ways we are doing it now are by perceptual learning or by dichotic therapy. So the newer amblyopia treatment falls into active or passive ways of treating. And active ways include perceptual learning, which includes dichotic video games, AcluPad, iBit, or the Vivid Vision, and the passive therapies, which includes dichotic movies and the pharmacological adjunct therapy. So what do you mean by this perceptual learning? That was discovered way back by Leonard Gibson in the 80s, and that depends on the adage that practice makes perfect. So when you do repeated tasks like sensory tasks, and that can improve the vision in the amblyopic eye. So they use stimuli like the Gabos patches and letter optotypes. And the neural basis for this is that there is a reduction in the lateral inhibition with the brain with training. So this was developed as neurovision therapy originally in Israel in 1999. And the Gabo filters are used to stimulate and activate the receptive fields in the visual cortex by Dennis Gabor, and he got a Nobel Prize actually for this discovery. So why this stimulus is being used? Because it is the most effective stimulation of the primary vision cortex, and individually designed frequencies, spatial arrangement, contrast levels, orientation and exposure durations are possible, and it is US FDA approved. And Neurovision has purchased by the Revital Vision, which is based in the US in 2009. So it is an in-home use on patient's own personal computer, and the software will measure the contrast threshold of the Gabo target with the flankers in the first two tests that they do. And then the patient has to identify which display has the 3 Gabo targets. So here you can see the target display with the flankers. And for amblyopia, around 40 sessions are recommended with 4 sessions a week. And there is an average of 2 lines of visual acuity with a 100% improvement in contrast sensitivity. So it doesn't limit to amblyopia. Even they say that 20 sessions are useful in improving the contrast sensitivity, as in post-LASIK patients and even post-multifocal patients. It can be tried very well, is what the company is saying. So this is the study which they put out in 2000-2001, where the mean best corrected vision in the amblyopic eye after treatment improves to 0.41, improves to 0.17 from 0.41 log mark. And in the control group, as you can see, it remains the same. And the improvement in the vision is maintained even a year after treatment, is what they said way back in 2001. But some drawbacks of perceptual learning can be that the improvement are noted to be specific to the trained task and not necessarily transposed to novel tasks. And always these studies are limited to very small number of participants. So we don't know whether it works in a larger group of patients. So coming to the perceptual dichotic stimuli. In perceptual stimuli, we use a single type of stimuli to both the eyes, whereas in dichotic, it presents independent stimuli to each other. As you can see in the pictures, you need integration of both the stimuli. Under binocular viewing conditions, it uses a red-blue glasses. So the contrast of the luminous input to the fellow eye, that is amblyopic eye, the good eye is reduced to match the performance of the amblyopic eye. And as the patient is developing binocular vision, so the contrast difference is reduced. And there is an improvement in visual acuity, and also similarly with binocularity and contrast sensitivity. So these are few of the games that are based on the dichotic stimuli, including the Tetris games, which was originally discovered in the 2010 around. And these studies, the Dichotic games, these are all have been studied in Aios 1820 and Bravo, which is the binocular treatment of amblyopia using video game study. But they all did not report a significant difference between the games and the traditional methodology for the treatment of amblyopia. So coming to virtual reality-based systems, which include the iBit, which is developed by a group in Nottingham, and that's based on 3 different mechanisms presenting fine. Yes, sure, thank you. By presenting fine and movable stimuli to the amblyopic eye and fix the targets to the dominant eye, one half of the image is shown to each eye, and they play these virtual reality-based games with improvement in the visual acuity. So again, we have the Oculopad or the tab, in which in the iPad Air, you can remove the polarization, and then the patient is asked to wear certain polarized glasses and play games. But it has been studied only in 5 patients, and they improved vision to by an average of 0.38 log mark after 2 months of treatment. And there's a new company called Vivid Vision in San Francisco, USA, who has developed the games. Again, these are virtual reality based, and they claim to get around 1.5 log mark improvement. So these are dichotic movies which are passive, which can just be watched. So here the range is really big, because any movies can be seen with this, and so the compliance is really good. Coming to Binox, they have revamped the system to named it as Ambly Go. Earlier games were only 3 in number, and now it's more than 5 or 6, and they are more interesting. And so you have to play these games for 30 to 40 minutes, at least 5 times a week. And the initial improvement is seen quite fast, and a good result can be expected in 6 to 8 weeks in appropriate cases. And again, they claim that the visual acuity can improve by 4 logmar lines and improve the stereopsis. So pharmacological therapies, I'll skip it because it's not really a recent advance. And then you have this intermittent liquid crystal glasses, which can turn on and off many times a day. And it's just a passive treatment. And you can have new devices which can monitor the adherence to patching in children, which again, there is not a lot of big studies on this, but this will help you to exactly note how much the patient is patching. So to conclude, there has been a lot of technological advancement in the last decade, but a lot of studies are needed because these are limited to very few patients. And if there is a wider study with a global study of amblyopia, then we give more information on this. And also it will help us to better define and categorize amblyopia. The thing is, the newer games and all these later binocular integrated therapies can help us to improve the vision by 3 or 4 months itself. Whereas in the traditional teaching of amblyopia, so we have to treat for years together. So that is the only good advantage of using these newer modes of therapy.
Thank you very much. I just want one question, because you're so detailed in your talk. What is the hope for our adult amblyopias?
Yes, all these treatments are possible very much for adult amblyopia. In fact, I try many of these treatments for adult amblyopia. And you can improve even in cases where we traditionally think that is not possible, as in strabismic amblyopia. But the important thing to remember is we need to do surgery and align the eyes first. So with the presence of a strabismus, it is not possible to do it. So either in small angle, we can give prism, or we can do surgery, align the eyes, and then we have seen quite a few cases where it improves by 2 or 3 lines also.
I think anisometropic amblyophias would do better, I think.
yeah, those are the easiest to treat. So for them, patching can be first line, especially as a child. But it is better to try these therapies once, or we can use that as an adjunct also. If the parents are really finding it very difficult, we can use these as an adjunct also.
Thank you very much.